on the road to let me start over. Welcome everyone. For today's session on the road to health, how to prevent or delay type 2 diabetes in your community. And today we're going to be going over session 3. So before we get started, these are just a few housekeeping items. All participants are muted upon entry. If your line is not muted, please make sure you do put it on mute just in case, so that we don't have any interruptions throughout the presentation. Also, make sure that you engage in the chat if you have any questions or comments or any promising practices that you would like to share with us today. Raise your hand if you would like to unmute. This meeting is also being recorded. The slides and recording link will be sent via email.
I just get worried about you.
After today's session, and please make sure that you provide a brief introduction of yourself in the chat with your name, your organization name, and your title, which I already see that some participants have done that. So for today's session, again, my name is Frida Pineda Sandoval, and I am the Training and Technical Assistance Manager of NCHPH, and I'm going to be helping Dr. Leon today with the activities that we're going to be doing throughout the presentation, and I'm going to pass it on to Dr. Jose Leon.
Thank you, Fide, and good afternoon or good morning to you, depending on where you are in the country. Thank you so much for joining us. This is our third session, and it's been very, I am very pleased and I'm very honored to be a part of this conversation. And remember that this is an interactive activity that the idea is to hear from all of you, all of your best practices, your promising practices, everything that you're doing to help your patients with prediabetes or diabetes, and making sure that we share our experience with others. So please make sure that you chime in. As Peter said, you can use the chat box, or if you would like to ask a question or participate verbally, we can also unmute you, and you can give us any comment or anything that you would like to discuss with us. So next slide, please. We have a very packed agenda for today's session. This is our disclaimer. We are the National Center for Healthy Public Housing. We are funded by HRSA to provide training and technical assistance to community health centers. We focused on those located in or immediately accessible to public housing. However, the training and the technical assistance is for all health centers in the United States. And thank you, Francis, for being with us today. Next slide, please. In case this is the first time that you are joining us, just a quick reminder about the health centers located in or immediately accessible to public housing. In 2021, 458 health centers reported to be in or immediately accessible to public housing, and they serve 5.7 million patients. 108 health centers received funding from HRSA to provide services to public housing residents. And in the same year, they provided services to over 900,000 patients. Next slide, please. In regards to those living in public housing, these are the demographics. There are over or around 1.5 million residents living in public housing. The average people per household is about 2. 38% of those households report to have at least one person with a disability. The 90% of those living in public housing are low income. 43% are African American. 26% are Latinx, 19% of those are over the age of 65, 36% are younger than 17. Next slide, please.
Right.
So we have a nice breaker, Fide.
Sorry, thank you, Dr. Leon. So this is just a quick icebreaker. If you could or would skip one part of your daily routine, what would it be and why? And this is just a brief question as an introduction to what we're going to discuss today. And you can provide your answer in the chat as well.
What do you mean with daily routine? Daily routine in eating, daily routine in working, daily routine?
Daily routine, whatever you do from the very time you get up to the very time that you go back to bed.
Oh, you mean my boring routine? Okay.
Dishes?
Yes, dishes. It's a big one. Mhm. Applying makeup, yeah. Cleaning. Cleaning out the little box. Okay. How about you, Dr. Leon? What would be your response?
That's a great question. I have never ever thought about this, but probably my dog. Walk my dog every day is always difficult. So probably that's something that I would like to skip once in a while.
Yeah. All right. All right. Thank
What
you,
would
everyone.
you be and why? If you
I'm
could,
sorry, I did the opposite. What I would like to do on a daily basis.
That's fine. Thank you so much for participating. This is just an icebreaker, and it's always a pleasure to have you. So in our previous sessions, we discussed nutrition labels. We reviewed some portions and size definitions, and we learned a little bit about the traffic size method. Next slide, please. So today we are going to briefly discuss the intersection between a healthy diet and an exercise program. We are going to list some tips for being more active, and we are going to discuss barriers for being active. Next slide, please. You can play the video.
Just a quick translation. This is in Spanish. It says movimiento por su vida, and it's, in English it translates to movement in your life.
Un, dos, tres, es el precalentamiento. Dos, tres, el ritmo del movimiento. Dos, tres, que sube, que sube, que sube. Movimiento, ya lo siento, se me sube por adentro. Movimiento, ya lo siento, celebramos la vida con aliento. Movimiento, ya lo siento, y que siga este momento. Movimiento, ya lo siento, los problemas que se los lleva el viento. Este nuevo baile te va a cautivar y una vez lo aprendas no podrás parar. No es tango, salsa ni es cha-cha-cha, es el movimiento, ya lo siento. Piensa en el presente y mira dónde estás. Mira hacia el futuro, es tu oportunidad. Ponte en movimiento y pronto sentirás ese sentimiento de triunfo. ¡Ya! La música la llevo por dentro. Es un sentimiento, un sentimiento.
All right, Peter. Thank you so much. And that's exactly what we wanted to communicate, the need to motivate our patients to move. This is an activity, or this is a program from the American Diabetes Association. And we are going to briefly discuss some barriers that patients have to exercise. And you are exactly showing, one of the biggest barriers, and one of the biggest barriers, in my opinion, is to motivate patients. So let's try to find the rhythm, the right motivation for them. There has to be something to motivate them. And in this particular video, we have that this is a very nice song. It's, in my opinion, a mix of salsa and rap and everything else. So that's what we have to do. And this is something that you can find on the American Diabetes Association website. It's in Spanish and it's also in English.
Yeah. All right, well, thank you, Dr. Leon. So this is our next question. What are some of the most common barriers to fitness? This could be, we're going to do a brief discussion about this. If you can just share your thoughts. According to you, what do you think? Yes, time. Time is one of the barriers to fitness. That is correct. Work schedule, health issues, chronic illnesses. Time is a big one. I think from my perspective, I can think of a disability as well. Space. Cold and snow. Yes, especially if you like to work out outside. The weather.
Yep. Neighborhood safety. That's a really good one. We have a publication on community safety, specifically those living in public housing developments. That's one of the main concerns that they have. Motivation, correct. So thank you so much for participating. Next slide, please. And you are all right. The Center for Disease Control mentions 4 or 5 challenges. One is people say, oh, yeah, I don't have the skills, or I don't have the resources. Weather conditions, we just discussed snow, or it's raining outside, or it's too cold, or it's too hot. Others mentioned that traveling is always an issue. They are always traveling, or family obligations. But every time that there is the opportunity to exercise, there's always the opportunity to find an excuse, to find a challenge. And but we don't have any challenges when we are trying to watch TV, to listen to the radio. So let's make sure that we, again, motivate our patients. Next slide, please. And we are going to go over some of the barriers. One is the lack of time. There are several strategies. For instance, you can talk to your patient and go over their schedule, see whether if there is any time that they can just exercise. Remember, we are going to be reviewing the recommendations about the length of time that we need to exercise. And we don't need to exercise for 2, 3, 4 hours. For our patients, it's really important that they exercise every day, and we are going to go over that. Another barrier is friends and family don't share your interest in physical activity. There are some groups that you can join either on internet. You can find them on internet. You can find it in the community. So people who can share your same expectations, your same routines, everything that you are doing. So that's how patients can address these barriers. The other one is the lack of motivation or lack of energy. Again, in this for this one, we've been discussing multiple times about motivational interviewing. You have to talk to your patient. You have to make sure that you understand their routine. You have to understand what can, there has to be a purpose, you know, and then once you find the purpose, you can make an agreement with your patient. You can make an agreement that they have to do it because they have a goal, they have an objective. Lack of resources on equipment. You don't need equipment. If you have a pair of sneakers and if your neighborhood is safe, then you can walk, you can jog, you can just do some briefly outdoor activities. And the family caregiving obligations, that's a tough one. We totally understand that we all have obligations, but there's always some time to exercise. So this is about having a conversation, an honest conversation with our patients, and making sure that we find the time, that they find the time, and that they set a goal. That is the objective, and how patients can address these barriers. Remember that when we are talking about patients with diabetes, We are just not talking about healthy eating. We are not just talking about having my plate and going to my plate and choose the cereal that you're gonna eat, or what you or the milk, or if you are going to have a little piece of dessert. I mean, you have to combine exercise and a healthy diet in order to prevent or manage diabetes. Next slide, please. So we're going back to our friends. This is the toolkit that we've been discussing for the last few weeks. And they found that in addition to healthy food choices, they have to move more, and they have to exercise at least 30 minutes a day. And that's the goal for this session. This is the main concern that we have, because patient can follow food prescriptions. Patient can follow many instructions. Patient can follow the instructions that you give them, the medication that they need to take, but it's very difficult to make them understand that they have to exercise. Next slide, please. So the Centers for Disease Control has some tips for being active. There are so many of these. I'm not planning to go over all these. All the slides are going to be shared, but there are resources. This is a resource from the Center for Disease Control that you can go over with your patients, making sure that they have what they need to exercise. But generally, the tips is, hey, try to exercise with someone else, with someone who can share your goals, your objectives, and a person who can support you. Making sure that if you are in a place that is not safe, try to do something indoors. There are some community organizations providing exercise programs, etc. Next slide, please. So the main message is there are no excuses, there are no challenges, only choices, and each day you choose to take care of yourself, because that's the most important piece of information that you can provide to your patients. It's not just to prevent diabetes, it's just to prevent other chronic medical conditions, the ones that you have already mentioned. We have been discussing obesity, we have been discussing heart diseases, cardiovascular diseases, high cholesterol. So all the exercise is the right prescription for all these chronic medical conditions. Next slide, please. The American Diabetes Association has some recommendations, specifically in regards to the types of exercises that we have to do every week. And they are promoting the aerobic exercise at least 150 minutes per week, which you can say, okay, I can exercise 30 minutes for 5 days, and you are going to be getting the recommended time, the 150 minutes. Then resistant exercise is extremely important as well. Some lift weighting if possible, otherwise anything that it can just increase resistance and build some muscles. And then flexibility and balance is extremely important, specifically for our senior patients. As we grow older, our flexibility is decreasing, so we need to make sure that anything that is like a yoga class or some stretching, we need to add that at least 2 or 3 times per week. Next slide, please. So exercise is a natural remedy. It's not only because we are trying to manage diabetes or because we are trying to manage other chronic medical conditions. Remember that the mental health issue in the United States is one of the priorities for HHS. And if someone exercises for 30-35 minutes every day, they are going to feel better. They are going to feel less anxious, they can avoid depression. So this is not just for your body, but for your mental well-being. Next slide, please. So for those who can't exercise, or at least they cannot run, they cannot jog, remember that has to be tailored to our patients. We can't ask a patient who has never exercised to start jogging or start running for 5 kilometers or five miles every day. You know, they can start very slowly. They can either walk, they can cycle, they can jog. They can go to the office and park the car farther away from their destination. They can get on or off the bus several blocks away and walk. Another recommendation is to take the stairs instead of the elevator or escalator, and play with children or pets. So there are so many ways that we can get our exercise routine every day, even if we don't have a routine to jog or to run or to bike or to go to a gym. Next slide, please. So remember, in addition to the medications, either the oral medication or the insulin that our patients are on, we need to promote the healthy diet and the exercise so they can manage their weight. They can make sure that they are not overeating and that they are exercising. Last time, during our last session, we had a balance. You know, that we saw that the calories that we have in are equal to the calories that we have out. I mean, we have to balance that out. Otherwise, we won't be making any progress. We can be eating very healthy, but nobody can stay on a healthy diet forever. Sometimes there will be the opportunity. We are social beings. Sometimes someone can say, hey, I need to have a drink, or I need to have some dessert, or I need to have a slice of pizza. You know, so if a person needs that kind of desserts or pizza or whatever they're having, that they are going to add some extra calories to their diet, then they need to find a way to burn those calories. Next slide, please. So there are some tips for people who have not been active, and we can ask people to gradually build up the time they spend doing the activities. We can suggest that they can vary their activities, ask participants to explore new physical activities. It's boring just to do something, you know, every single day. In my case, I like running. I try to run at least 5 miles every day, but sometimes I don't want to. And it's not that I am tired, it's just that I am boring. It's okay, I'm doing this one more time, and I can't find the motivation. But sometimes if you have a bike, you can ride a bike, or just walk your dog, walk with a friend. Go to the park and enjoy nature. All these are very helpful tips, you know, so you are not going to be doing exactly the same over and over again. So we need to find different ways. As we saw on one of the previous slides, the American Diabetes Association is asking people to do aerobic exercises, but at the same time, other exercises, just to vary the routines, and otherwise people cannot be on the same routine forever. Next slide, please. So we would like to have a breakout room discussion with you, with all of you. We are going into some breakout rooms, and we have 4 questions that we would like to discuss with all of you. First is, how do you discuss physical fitness with a patient? This question is not only for those patients who are trying to manage diabetes or prevent diabetes, but in general. I mean, we don't need to be sick in order to do some physical activity. So physical activity should be part of our daily routine. So how do you discuss this with a patient? Our next question is, how do you counsel a patient about exercise? So what strategies, what do you tell them that they need to do? And the other two are for the from an organization perspective, from a health center perspective. And the first question is, how does your health center support a patient to be physically active? In other words, we've been talking about community violence, or it's dangerous to be outside. So what programs, does your health center offer, or what agreements does your health center have with community organizations? And the last question is, how does your health center promote physical activity in patients? It's not the same what you do as a community health worker, but what the health center in general is doing to promote physical activity in patients. So we're going to go for about 10 minutes to breakout rooms, and then we're going to come back and have a brief discussion about the findings, about what you're recommending, about your promising practices. So Chantel, Fide, if we can
Yeah, Chantel,
do the breakout rooms.
she's gonna start.
Am I in some group?
Not yet. I think she's working on it right now. She's
Oh,
working.
okay. I'm saying like, I can't do it.
Hi there, I'm in a group here.
So you're going to receive an invite.
All right, perfect. So I guess everybody's back in the line. Okay, so we're gonna do a debrief. So for the first question, would anybody like to provide a response or like a summary of what you discussed in your group? How do you discuss physical fitness with the patients? Sure, Yvette.
I met some lovely ladies from Texas and Utah, and wow, it's incredible how different, well, how a bit of a difference we do have. Some of us do not discuss physical fitness with a patient simply because they don't deal with patients directly. There was one young lady from Texas that she actually stated that they have contractors that throughout the United States that they actually promote physical fitness, or like walks, or like sort of group things. So that was nice, even though she's aware of it, right? Because she has to approve the contracts. So the lady from Utah, Sarah, very nice. She actually, I was amazed by it, because they have to do prescriptions to patients just to go outside. So, and they have very beautiful parks and mountains and a lot of trails for hiking and all of that. So I thought that was very interesting, that their health center will actually do a prescription for participants to go outside and enjoy the sunlight and do park activities. And in my health center here in Worcester, Massachusetts, what the health center does is they give membership cards to the YWCA for patients that would like to either go swimming or enjoy the gym or do some sort of physical activity.
Okay. All right, perfect. All right.
I think everybody had just different ideas. We're the same want you to say in the same circle of what we're talking about, but everybody's had different ideas, and everybody's ideas were just kind of great input for everybody else to use. Every clinic is so different the way they process their stuff. So, you know, and come along with the patients, but at the end of the day, it's about the same. Very, very interesting.
Yeah. Thank you so much for that feedback. So now we're going to move on to question 2. How do you counsel a patient about exercise? Would anybody else like to volunteer?
Yeah, one of the things that that I have mentioned is that I do a group out in the community, and counseling, talking to them about it is more from the self-care. You know, a lot of times these moms are busy just taking care of other people, and so when you approach them about how important it is to do the self-care, then you then introduce activities that allows them to move around and to be more physically engaged.
Thank you. Thank you so much, Maria. And what health center organization are you joining us from?
I work at a COOC, which is a Community University Healthcare Center in Minneapolis, Minnesota.
Thank you so much. All right, so for our third question, how does your health center support a patient to be physically active? Do we have another volunteer for this question? Don't be shy. Okay, I'm gonna pick out.
So I was just going to tell you a little bit more about that program that Yvette was telling you about. So it's ParkRx is a national program, but it's a program where I actually put a link in the chat if you want to check it out. But it's a program where providers, actually anybody, can prescribe outdoor activity to patients. And sometimes when a patient actually gets a prescription, I think they might be more motivated to do it. But then once they've gotten out and seen the nice areas that are around and available to them, they'll maybe be more likely to continue with something like that. So that's one of the things that we do to encourage. We have a ParkRx day at one of our parks, and we've partnered with a local aviary where if they, get the prescription, fill the prescription, they get a free pass to the aviary for the day. Things like that, just incentives to encourage people to be outside.
Thank you, Sarah. Sarah, may I ask you a follow-up question?
Yeah.
How far is the health center from these parks, and whether or not you offer some kind of transportation or any services?
That's a really good question. So I actually work with Salt Lake County Health Department, so I'm not with a specific clinic. So as providers give prescriptions, they can talk to the patient about where they live and kind of talk about which specific parks and areas are in their areas or accessible to them. Our public transportation system is not awesome. I mean, we've got it and it's okay, but we've got some areas to improve there for sure, as far as being more accessible. But we've got some really pretty areas out here. So and we try to keep our parks and things clean and inviting and welcoming. But yeah.
Thank you.
Thank you. Thank you so much, Sarah. So for our last question, how does your health center promote physical activity in patients? Okay. Would Alexandra Alvarenga, would you like to participate? No? Okay.
Okay, about our institution, no promote, but recommend that maybe it's possible go to the YCM or practice walk around home or out home, but in specific, no, don't promote. Only with a patient have an appointment with the PCP. PCP may recommend to them practice some sport exercise. but it's only one decision. Our patient, continue to follow up this recommendation.
Excellent. Thank you, David, for participating and chiming in on the question. And I in regards to promotion, I heard the prescription, program. That is a really nice way to promote activities, physical activity, just by give them a prescription. And as David mentioned, work in conjunction with your PCP or your medical staff to make sure that the patient is fit to exercise, because that's another thing that we need to discuss, that we cannot recommend any type of activity until the patient has received the okay from our clinical staff that they can exercise, because they can have other chronic medical conditions. And so I totally agree with you, David. Thank you.
Jose, I know for a fact that housing, if they have like a gym in one of their floors or whatever, they actually they demand that you bring to them a certificate of fitness from the doctor in order to use the gym. And the gym, once they get that authorization that you're okay to exercise, then the fob, they will put a code that will give you access to that gym. Otherwise, you won't be able to walk in.
Excellent. That's a great idea. Yeah, and you're right. If you go to a private gym, yes, I have never seen, that they ask you whether or not you can exercise. So that's a really good point.
Especially if it is a senior, senior and disability housing facility.
Correct.
Yes, they will do that.
Yes, and thank you. Before we move on, I am curious, for those who participated in the last session, did anybody visit the recommendation about the UCAP? I'm just curious, did somebody download the application, or I remember having a really good, oh, Danny, you did. Excellent.
Yes, I did. It was great. I had my mom using it too.
That's really good. Yeah,
She's my mom is 84, and she's scanning everything she buys.
That's nice. That was a really nice tip. Was it you, Yvette, who recommended it?
Oh, you mean Yuka?
Yeah, the UCAP.
Yeah, Yuka application. Oh yeah.
Thank
Really
you.
good.
All right.
Good.
Thank
And
you.
they give you, I love the comparables, No, you can use this product instead of this one, and it gives you the reasons why you should use another product.
Thank you. I haven't downloaded yet, but I promise I'll do it this week. Next slide, please, Fide. So remember that every time that we exercise, every time that we move, there are always risks. We have just discussed that in order for exercising, we need to get the clearance from doctor or from a doctor, making sure that the patient can exercise. Remember that some of our patients can have severe hypertension. They can have a cardiovascular disease that probably they won't be able to exercise. They can have some arrhythmia or any heart problem. So it's really, really important, to have this conversation with our patients before we even recommend an activity to our patients. There are several tips for patients. The first one is we have to listen to our body. If you feel tired, if you feel like some kind of pain, you need to stop. we need to recommend the patient to make sure that they address the issue before going back to their daily routine. We need to make sure that the patient understand about muscle soreness or any kind of sign that is not something that they are experiencing. And we need to be aware that and we need to make sure that our patient understand the signs or symptoms of a heart attack or any other heart issue, sweating, chest and arm pain, or palpitations, or whatever they feel, they stop immediately. The main recommendation, and this is something that even those who are experienced forget to do, is to warm up. Let's make sure that we tell patient, before you do any jogging, before you do any activity that is moderate or intense, you need to warm up for at least 3 to 5 minutes. The idea is to start at an easy pace, and then the other recommendation, now that we are just going into spring and summer, is to drink plenty of water, specifically if they are exercising outdoors, making sure that they don't get dehydrated, and making sure that they don't get any heat stroke or any other complication if they're exercising outside, outdoors. And next slide, please. A couple of resources for all of you. This is an NIH resource that is currently available. This is the body weight planner. If you have a patient and you would like to discuss some goals for them, you go to this website. And again, don't worry, we are going to share the slides, so you will find all this information. And they will they need to populate what the program is asking. And at the end, they are going to get information about the number of calories that they can take, the number of or their ideal weight, and the time that they need in order to make all this process in a very safe way. Next slide, please. We've been talking about motivating patients. This is another resource from the diabetesatwork.org about progress that patients are having, the type of physical activity. To keep a diary is extremely important for some patients, and that is another way to motivate our patients to exercise. Next slide, please. There is a contract or an agreement as well from the same organization. Once you talk to your patient, the patient can sign the agreement. It has all this information, what they are planning to do, when they are planning to complete this activity. So all these are really good strategies to get the people involved and at the same time motivate our patients. Next slide, please. And there are some quizzes as well, specifically regarding the barriers. If we are trying to identify some barriers for some patients, there are some quizzes that we can use, and then you will find with your patient exactly what the main concern is and how they can address those concerns or those barriers. Next slide, please. And then you can see that at the end of this quick survey or quick poll, there is a score. You can score it and see whether this is due to lack of time, due to a social influence, lack of energy, whatever the challenge or whatever the issue is. Then you can address those issues with your patients. Next slide, please. Then remember that our patients, when we have a patient and this patient is trying to prevent diabetes or to manage their diabetes, is not only the healthy diet, it's not only the exercise, it's not only motivating our patients to get in movement. We need to address, or we need to make sure that we address other issues, such as lack of sleep. If a patient is not sleeping well, the patient probably is not going to exercise. I mean, the patient will be tired all time. So there are some things that you can work with the doctor, and get involved this patient in a brief behavioral therapy to address the lack of sleep. The other issue that is very common that we hear a lot from health centers is the medication non-adherence. Some patients do not take their medications the way that they have to take them. So we need to provide them with education, make the medication routine, making sure that they engage in some social network. And the other topic that is important, and there are several organizations that they barely mentioned this, and is the smoking issue. We have plenty of resources on our website about how to work with your patients on how to stop smoking. And if we address this issue, we are going to make sure that we are helping our patients in a very, very integral way, and not only addressing the eating habits and the lack of exercise. This is taken from the American Academy of Family Practitioners. And again, you are going to receive all these resources after this webinar is over. Next slide. So it's about time. Thank you so much. Please don't forget to complete the survey. And next time we are going to talk about some of the challenges that CHWs have to address all these issues. And we are going to have another activity, another breakout rooms, how you can promote all these really good habits among your patients. So thank you so much for your time. And if you have any questions, again, these are our contact information. You can contact Fide, you can contact me, you can contact Chantel, who's been helping us with all the technical issues and everything else. So thank you so much, and have a great afternoon, everyone.
Thank you, everyone. Bye.